Hello and welcome. You're watching Medically Speaking with me, Meenakshi Ukreti. It's a very special edition where we will be talking about breast cancer. Yes, it's Breast Cancer Awareness Month, and we are going to be focusing on not just the treatment, but also the causes for breast cancer. The idea really to spread awareness around breast cancer. How can you examine yourself? How significant it is, and how early diagnosis helps. All of this and more we will be discussing with a battery of experts. I'm starting with Dr. Vijay Agrawal. He's the lead and senior consultant of medical oncology at the Aster Hospitals. Thank you, sir, for joining us on NewsX. It's a very important topic, something which we all must know about, we must speak about. First question, what are the early signs of breast cancer, which one must watch out for, sir?
One of the earliest signs of breast cancer is generally a lump in the breast or under the armpit. Occasionally, it can also happen in the neck. They can also be discharged from the nipple or inversion of the nipple or redness of the skin over the breast. These are some of the earliest signs, and they're all centered around the abnormalities in the breast. And I think all women should know how their breast normally feels like or looks like and examine them regularly to see if there's any changes. And that is the only way to pick up any breast lumps earlier on, is by being self-aware.
So next question, what are the screening methods for breast cancer? How often should one get screening mammography? And perhaps how often should one go for a clinical breast examination?
So breast cancer screening should be standard across all communities. There are two aspects to it. One is self-breast examination. All women should examine their breast once a month. Okay. And there are lots of literature online as to how you can examine the breast. But once a month is a good idea to examine the breasts. And the gold standard for screening is doing a screening mammogram, generally done once every 2 years, once the woman hits the age of 50. We can also start at the age of 40. Okay, and that is a choice that women can make, whether they want to start earlier on, particularly if they have a strong family history of cancer or cancer or they're concerned about cancer. So once in 2 years, going forward, once they hit the age of 40 or 50, depending upon their choice. Clinical breast examination is not regularly required unless there is a suspicion that there is something wrong with it. Otherwise, self-breast examination and mammograms are the way forward.
Also, tell us, sir, what are the treatment options for breast cancer?
So the breast cancer treatment, we have a lot of options nowadays. A lot depends upon at what stage the breast cancer is picked up at. So generally, if it's at stage 1, 2, or 3, they tend to be curable. And the main modalities of treatment are surgery. We also use things like chemotherapy, immunotherapy, or targeted therapy around surgery to improve outcomes, and also consider radiation. Particularly if you're trying to do organ preservation surgeries such as breast conservation surgeries. So the options include a multimodality treatment, which are generally decided by a multidisciplinary team rather than a single individual. Nowadays, I think the advances are becoming regularly and quite a lot. And with every changing time, new and new modalities of treatment are coming through. If the patient is diagnosed with advanced stage breast cancer, even then, it's not all doom and gloom. The survival has been increasing significantly, and we tend to use the primary chemotherapy, targeted therapy, or immunotherapy, and hormone therapy as treatment modalities for breast cancer.
Sir, is there a familial aspect in breast cancer? Is it genetically linked? Can you throw some more light on the same?
Yeah, so about 15% of the cancers we see in our practice can be familial, and breast cancer is one of the commonest familial cancers we see. So there are certain genes, the commonest ones being BRCA1 and BRCA2 genes, that can be mutated and run in families, increasing an individual's risk of developing breast cancer along with ovarian cancer. So yes, there is a familial risk. Genetic testing is, as a routine, not required, but clearly there are clusters of cancers within the family members, then certainly gene testing can be done. It's quick and easy to do it. It's just a blood test, and the report takes a couple of weeks to come through. So if there's a strong family history and someone is concerned about a familial risk, they should undergo genetic testing. If positive, then of course genetic counseling and undergo a regular breast screening program. And in that situation, it may be more frequent than a standard 2 yearly mammogram. You may want to consider doing it on a yearly basis.
Thank you, sir. It was a very riveting and informative session, and thank you for taking our time and speaking to us. And for our next session, we're being joined by Dr. Shyam Agrawal. He's the HOD of Medical Oncology at the Sir Gangaram Hospital. Thank you, sir, for joining us. My very first question, and a very common one. First of all, what exactly is breast cancer? How common is it in India? Are there different types of breast cancers? And another question, which is related to the same, how many years can one survive with breast cancer? Because cancer is a word which brings a lot of fear, doom, and gloom in the patient's mind.
Breast cancer is the cancer which arises from the mammary ducts, which are present in the breast. And women have the highest incidence of breast cancer, as you can understand, although males can also get it, but the incidence is very small. Now, coming to the incidence of breast cancer in women in India, so nearly 1.8 lakh new cases of breast cancer are diagnosed each year. And this is surpassing the uterine cervix cancer, which used to be the number one cancer in women. This is largely because of the change in the socioeconomic status and the lifestyle changes which are happening in our country as well, like the Western world. So breast cancer is of many types, but coming to the practical part, it depends on the hormone receptor positivity and HER2 receptor positivity. So patients can either have hormone receptor positive, HER2 receptor positive, and if all these are negative, then it is called triple negative breast cancer. So the survival in a patient with breast cancer depends on what stage it is being diagnosed. If the patient comes to us in first or second stage of breast cancer, then these are curable to the tune of 80 to 90%, and women can expect to live a normal life. But as the stage of cancer advances, especially in fourth stage, the survival can be, as short as few years, like 4 years to 5 years to even 10 years. But yes, we have converted this advanced stage fourth cancer of the breast into a chronic disease with the current available medication.
Help us understand, sir, how do you exactly diagnose breast cancer?
First of all, a lady has to, report with a lump in the breast, so which is usually painless, or there is a nipple discharge, which could be a bloody discharge. And there can also be a feeling of a lump in the armpit or in the axilla, or there could be some kind of a skin retraction in the breast area. So once you have these kind of symptoms, then one goes to a doctor who physically examines the breast of the lady, and all the lumps in the breast may not be cancerous. But once there is a suspicion of breast cancer, the first step is to go for a X-ray of the breast, which is called a mammogram. And in younger women, sometimes MRI of the breast also may be required to delineate the nature of the breast lump. So once there is a strong suspicion of breast cancer on mammogram and MRI, then a needle test is performed to look at the cells from the lump which is present in the breast. And those cells, if they look cancerous, well, then the patient is declared that she or he has a breast cancer problem. And then, of course, you need to do the staging, for which a chest X-ray, an ultrasound of the liver, and a bone scan is required to see whether the breast cancer cells have spread to various parts of the body or not.
And how does breast cancer spread, sir? Can you throw some light on the same?
So, as I mentioned previously, initially the size of the lump in the breast will increase, and then through the lymphatic channels in the armpit, there are nodes. The tumor cells, they spread into the armpit, and one can also feel a lump there or a nodal enlargement in the armpit. Then through the blood vessels, the tumor cells can spread to the lungs, and patients can have, X-ray or CT scan lesions in the lung. The tumor cells can go to the liver, the tumor cells can go to the bones, and finally the tumor cells can go to the brain. So these are the 4 common sites of spread, lungs, liver, brain, and bones.
What is the chance of recurrence of breast cancer, sir? How common is it? If one is cured completely and had rid of breast cancer, can it come again?
Depends on the initial stage of cancer at which the diagnosis is made and the treatment is given. So if the patient is in stage 1, which means that the size of the tumor is less than 2 centimeter, there you can expect more than 90% women to get cured, which means that about 5 to 10% patients can recur after several years even. As the stage advances, in stage 2, for example, when the tumor size is more than 2 centimeter, or there are lymph node enlargement in the axilla or in the armpit, then the chance of recurrence goes up to about 15 to 20 or 25%, depending upon the type of breast cancer. So, the initial staging is very, very important. And patients who are in stage 3, again, the incidence of relapse or recurrence is going to be higher. In stage 4, it is not possible to eradicate the cancer. And these patients, we can expect to give them a long life, good quality of life with the present hormonal therapy, with the present anti-HER2 therapy, and the availability of several chemotherapy drugs.
Thank you, Dr. Agrawal, for taking out the time, speaking to us and helping us understand all these aspects of breast cancer and breaking the myths around breast cancer. And now, after Dr. Agrawal, we'll be joined by Dr. Som Shekhar. He is a surgical oncologist at the Aster Hospital. Thank you, sir, for joining us. Very first question, are there any risk factors related to breast cancer? Is there anything which can increase one's risk of getting breast cancer? And also, are there any ways to reduce these risks, sir?
Yes, definitely it is possible. As I told you, low BMI, reducing the fat definitely will reduce. There is a randomized control trial called as PLCO trial, which showed that if a woman does 20 minutes of brisk exercise daily, physical activity, is less for her height. See, like if you see for any person for their age and height, there is a fixed weight. If you are less than that weight, take high fiber diet, maintain a healthy, very good lifestyle, and then have servings of fruits and vegetables, low of fatty meal, not take hormone pills. This PLCO trial showed by doing all together, not one. You can't say, 20 minutes I walk, but I'll eat other, I'll not do lifestyle modification. All together, what I told, if you do, it is scientifically trial-wise by PLCO trial showed that the risk of breast cancer coming can be significantly reduced. However, this needs to be coupled with breast self-examination, annual screening mammogram, and a good breast awareness and screening to identify early cancer to have a better outcome.
What about radiation from mammogram, sir? Should one be worried about it? Is there any side effect of the same, and where can it exactly be done?
Now, there is a myth among people, common public, I don't want to have X-ray, I don't want to have frequent mammogram. Doctor will say 1 mammogram now, 1 in the next year. What if the radiation I receive from mammogram itself is harmful? Answer is no. It is scientifically proved for a mammogram, we receive less than 1 centigrade, 1 gray of radiation, which is less than the radiation received from sunlight and a simple X-ray. It is scientifically proved, even if a woman, say after 40 years, she'll have 1 mammogram. By the time she reaches 70, they would have had about 20, 30 mammogram, 20, 30 times. All this, even if she has 100 mammogram in her lifetime, all the radiation put together she receives is very low dose, not harmful, nor it itself will cause cancer. So this myth is wrong, that the dose of radiation we receive mammogram is very small. Even if you do it every year for next 20, 30 years, that is not harmful. In fact, walking daily in the sunlight radiation from the TV, refrigerator, surrounding area, and other is much, much more than the mammogram. So the message is, please go and do annual screening mammogram. Don't be afraid that mammogram itself radiation causes harm. No, that is a myth and wrong.
Right. And taking the same thought forward, sir, are there any side effects of breast cancer treatment? And if any, if the answer is yes, how can they be managed?
Yeah. See, typically a cancer treatment has got 4 modalities. Surgical modality, where you do surgery. Chemotherapy, if they come little late, we give in a glucose drip medicines which go in the blood and kill all the cells. Radiation, local X-ray, then hormone triplet and immunotherapies. Now, surgery per se, now we don't do mastectomy. This is an era of organ preservation protocol where we preserve the breast. So rarely a woman loses a breast if they come in the right time, unless it is not advanced. So that itself will not have much side effect. However, there is another component in the surgery called removing the lymph nodes in the axilla or the armpit. If you remove all the lymph node, then the woman develops a lymphedema or a big elephant hand with shoulder mobility problem, skin problem, hand stiffness and thickness of the hand called lymphedema. So that is a side effect which has no permanent cure. So nowadays, to prevent that, we do a state-of-art treatment called as SLNB, sentinel lymph node. We use a special blue medicine and a colloid to identify which of those 15 lymph node cancer is involved. And if the sentinel node comes negative, then we don't have to remove all the lymph nodes and give this lymphedema complication. So we treat lymphedema in lymphedema clinic by stocking primary LVA. Now in my cancer center, we do primary lymphovascular anastomosis, same time if I remove all the nodes to prevent elephantiasis. Now the side effect of chemo. Practically with modern medicine, other than temporary hair loss, which is temporary and it comes back fully, practically no much side effect. Vomiting, fatigue, body pain, all that is old time. Now there are prophylactic medicine given as pre-medication which will prevent that. Even there are special device now called scalp cooling device. During chemo, if we use those devices, even hair fall is also prevented. Now radiation, with a modern radiation, hardly any side effect. No burning of the skin, no local problem other than mild tanning, like a mild sunburn, no other side effect. Hormone therapy has a little effect on the bones. They make the bone weak. To correct that, we give calcium, vitamin D3 and also bone mineralizing medicine. So in short, all the modalities, surgical, medical, radiation, and then, our modern era are highly tolerated, least discomfort, least side effect, and maximum benefit. So in this era of modern medicine, all are so negligible that a woman comes, take the treatment, next day she can go back, drive and do all her work normally day to day.
What's new in breast cancer research?
Now, fantastic maximum change has happened in last 5-year breast cancer treatment. Number one, we have moved to immunotherapies. Instead of chemo or targeted therapy, we use our own immunity to enhance. Now, this is an era where we do genomic personalized medicine treatment. No two breast cancer in 2 different women, same. We now do genomic analysis and then we give targeted genomic PARP inhibitor tablets. New thing. Second, we have got a new test called as genomic profiling of breast cancer. In old time, everybody received chemo. Now, when we do surgery from the tumor tissue, we do an analysis and find what is the risk of cancer recurrence based on this genomic profiling for that individualized, personalized treatment. And the test will tell what is the chance of cancer coming back, 5%, more percent at 10 years, can you avoid chemo? Next, we have developed new treatment called as immunotherapy, targeted medicine in women. Even if a lady comes in advanced cancer, it has spread outside stage 4, there is a new medicine called CDK inhibitor where we can give the 2 tablets by mouth and avoid chemo. And in case of radiation now, intraoperative IOERT, intraoperative electron therapy radiation has come, where you do surgery breast preserving and you give 1 shot of radiation during surgery in the radiation room by special machine that is available from Italy and US. And women don't have to come for 1.5 month radiation like before. So much advances has happened in genetic, personalized medicine, sentinel lymph node state-of-art surgery, oncoplasty, breast cosmetic surgery, intraoperative radiation machine, 1 dose, and immunotherapy, target therapy. We call this minimum effective treatment instead of maximum tolerable treatment, with highest cure rate, best cosmesis, and fantastic quality of life. Maximum research has happened, more and more cure with least side effect, with fantastic quality of life.
Thank you so much for joining us and helping us understand really so elaborately all these aspects of breast cancer treatment. And as we end the session, I'd like to thank all the three experts, the doctors, oncologists who joined us on the show and helped us understand various aspects of breast cancer. We've tried to cover from treatment to cure and, of course, risk factors, and even how you can manage the side effects, if any. End of the day, what is extremely pertinent? That is self-breast examination, going for regular mammograms. If you are at a risk factor, keep getting yourself checked. End of the day, early diagnosis really can help you go a long way. That's the big message coming from this program. On behalf of NewsX, I thank all the doctors. It's a wrap on this extremely special show.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.